Hello again, this is Dr. Bill Wyatt, and we're still talking about these Class 2 Division 2 cases. And this is case number 3, and we'll go through it, just show you what we did and how it turned out. But I'm going to get on one, I think, the next time, show you the details of how you do a Class 2 Division 2. So we're going to get through this pretty quick. This is a nice young man, and he's got a kind of a tucked-in Class 2 Division 2 on the teeth. You see how they just kind of pulled in like this, and so we're going to just kind of raise that up and open them up. You don't see his lower teeth either down here, that's covered up, so they'll be crowded in underneath here, and we'll just raise these up. And you don't take any teeth out on cases like this if you can at all avoid it. And so we try to keep, now you can get people that's mixed up like this and you need to take some teeth out. You can do that to keep the facial structure in a normal condition. Excuse me. Okay, there it is on one side of the Class 2, and we're going to bring this molar right here. We're going to slide it over and have it fitting like that. And then about that distance in here is what we're going to bring these teeth out. But we'll bring these back some, and we'll bring these out, most of it. And we're going to raise this again, bring this down, and we use these intruding arch wires. They come in, and we did that like that. You hook it on there, and this one up here, we go around and you bring it down and raise those teeth up like that and flatten the arches out or get them pretty close to flat. Okay, and again, this is 2000, and here it is, this is the lower arch now, and you can see you've got a smaller cavity, line up like that, and we will try to kind of widen these out a little bit to show the teeth better. In the same way up here, and we can do that with a large arch wire or just a regular arch wire. Sometimes you can get them out, but if they don't move, we can use this big wire we put on top, and you can leave a gap out here and pull that to it, and then that'll open that up big enough. All right, let's get down here and see what we did. Now he has wisdom teeth. He's got all 4 of his wisdom teeth that look good, and they're in a pretty good condition. We don't mind if you wanted to keep them. They could be laying down like this. You know, we could still bring them in, or in fact, if they were even flat down, we could bring them up. We've got a method of bringing in any teeth. We can bring them into the mouth, and you could tip them and fix them in there right. Now this, when you look through the x-ray here, we bite 2 all the way, and you can see the lower teeth come up to here, and the lower teeth are up here, and the upper teeth are down here. You're going to separate this and open it up like that. So let's take a look at that. Now here are these arch wires, but it's a regular wire we put in there. I don't know why we've got a picture of the large wire coming in, but here we have opened it completely, and you've got the upper teeth fit down here with just a little bit of what we call overjet and overbite, and that allows you to reach out here and bite something off, and you can also glide your teeth from side to side, where you can't do that with a deep bite. You can. Now this young man may have grown a little bit, but you see we've got room for these wisdom teeth to come in now, and we'll try to save those 2, and that's the best chewing tooth in the mouth, and they're right around where the muscles are pulling the jaw together, right over those teeth. And if you get out here, you got to have a lot more force on there, and then if you bring your jaw forward, you got the condyle out in front of the retrodiscal tissue, and it doesn't work too good like that. So here we go. Now this is closed bite. This is 985, and now we've opened it a little bit, and there it is, open more. All right, here are the finished teeth where we did this completely, and you can see this is when we started, and this is 3 years later, and we finished this out. So we just kind of rounded this out, and we intrude these teeth, upper and lower. Down on the bottom, you see we've lined them up, but his wisdom teeth haven't come in yet. And we finish this 03. There it is, closed again. Now, here we're in a retainer, and this is kind of distorted here. This comes over back this way. You don't see the buccal part of the teeth on that side right there. And then whenever you have somebody that's closed bite, you make a retainer. You put some soft acrylic in here after you have the retainer made, and let them bite into that, and now you trim it off, and you've got a place for the lower anterior teeth to fit up in underneath there. And as long as they wear that retainer, those will not deepen back again, but it can. Now here we've got a picture. His tongue's over the cover of that tooth right here, but these teeth are biting right into that groove like that. And you need, if you have a closed bite and you open it up, it'll try to close back regardless of what you do. In every one, if you open the bite very much, it'll try to close back. So you put a retainer, make a little bite plate in there like that. And that is the end. I don't show the wisdom teeth in here, but I think they came in later on. He had time enough for them. So we thank you for watching, and we hope you learn how to do Class 2 Division 2 cases. There's a lot of this going on, and you can take somebody that could be 50, 60, 70 years old or more, and you can still do it. They will work fine. So thank you, and I'm going to close up here. And this is a mirror in the mouth, you see right there, like you'll see. Sorry, anyway, we'll pass on up there. I missed that, poked this tooth the wrong way. Thank you now, and I'll close out.